So thank you again. We're going to switch over to Asal Bastani from University of California in Los Angeles. And this last presentation's title is The Effect of COVID-19 on Primary Care for Patients with Neurodevelopmental and Intellectual Disabilities.
Hi, everyone. My name is Asal Bastani. I'm a third-year undergraduate research assistant at UCLA, and the name of my study is The Effect of COVID-19 on Primary Care for Patients with a Neurodevelopmental or Intellectual Disability. For the rest of the presentation, I am going to be turning my camera off, so you won't be able to see me. This is because my Wi-Fi is a little weak, and I'd rather not have the audio cut off, so apologies for that. But hopefully you'll be able to hear me well. Okay, so throughout the pandemic, it was not a secret that the general population faced resources inaccessibilities, as I'm sure we all experienced throughout the pandemic. A lot of places were short-staffed, and as a result, accommodations for people who needed them were put on the back burner, not attended to as well as they could have been. So patients who identified as neurodivergent faced even more of a discrepancy with the lack of resource accessibility compared to the general population. For context, a neurodivergent individual is anyone who identifies as not being neuroatypical. So neurodivergent individuals may include people who have been diagnosed with autism, ADHD, or other intellectual or neurodevelopmental disabilities. So during my research, I conducted a literature review, and I found some pretty shocking facts, including that those with an intellectual disability were 2.75 times as likely to die following a COVID-19 diagnosis when compared to the general population. And I really had to ask myself, why was this happening? Where can we look to find the underlying cause of such a huge discrepancy in this number that we see here? These are the questions I first thought of when I was drafting my study, and then I realized a good source of information into patient experiences might be primary care, whereas clinicians have interactions with many patients and can be a really rich source of uncovering patient experiences and, of course, clinician experiences throughout the pandemic as well. So the methods that I used for this study is I conducted 6 semi-structured interviews with clinicians and primary care providers that worked at a collaborative clinic in California and interacted with neurodivergent patients. The interviews were conducted over Zoom and ranged from half an hour to an hour long in duration. My interview questions focused mostly on gauging patient experiences through anecdotal evidence told by clinicians and also understanding the challenges faced by clinicians when transitioning to telehealth services. Some notable themes that I noticed across interviews are the benefits of telehealth were heavily emphasized, as well as the outstanding patient satisfaction and preference towards telehealth. Also, it was emphasized that even though telehealth proved to be extremely effective in a delivery platform for healthcare, there is an unchanging need for in-person health services, as in virtual healthcare cannot take the place of in-person healthcare. The regression in health services, in health conditions, due to the lack of services included in treatment plans. So with this theme, it was noticed that since a lot of services were inaccessible during the pandemic, such as behavioral health therapy, it became really hard for patients to keep up with their progress and their diagnosis. And a lot of clinicians often noticed regression in their patients' diagnoses because of that. Some quotes that really stood out to me in the interview, I put them right here. There's 3 quotes. I'm going to read the first one in purple. It says, "The best part about telehealth visits is a window into the world of the patient. This is really one of my favorite quotes because it showed up repeatedly throughout several interviews, and this exact same wording. So I thought that was a little interesting. Um, the second quote really talks about the convenience factor in telehealth and that patients don't have to commute. And for specialized care, it wasn't uncommon that patients would commute up to 2 hours. So not having to commute really reduces the inconvenience to the patient and their family, and also the carbon footprint of such a heavy commute. And the third quote highlights that even though telehealth proved to be really effective in delivering healthcare during the pandemic, it may also have some negative implications in that a patient may not have the privacy they need to disclose sensitive information during their appointment, and thus may affect the care that they get as a result of their appointment. So that was one negative impact of telehealth that was brought to my attention during these interviews. Some limitations of this study is that there is a huge lack of resource on the effect of COVID-19 on primary healthcare services for neurodivergent patients. It was extremely difficult to find articles that specifically focused on primary healthcare. A lot of articles and research were focused on emergency healthcare. Also, my study did focus on a specific geographical region, a small portion of LA. So there is still a lot of work to be done to properly represent the neurodivergent population of even Los Angeles. And for future applications, there was a huge push to continue the implementation of healthcare through telehealth, and also a big push to implement some guidance to widen and sustain accessibility for necessary services and patient care plans to prevent regression in their conditions. And that is the end of my presentation. I'm going to stop recording and answer questions live now. Thanks so much.
Thank you so much for that. Does anybody have any questions? Something that I was thinking about when you were talking is I just recently read that that schizophrenia is one of the biggest risk factors for dying from COVID, as second only to advanced age. And I thought that was really interesting. And they were talking about how it's really contributed to their understanding of schizophrenia as not just a disease focused on the brain, but all the whole body. And I just wondered if you could tie those things a little bit, like in terms of being neurodivergent and dying during the pandemic. Like, can you say a little bit more about like that connection and what you attribute that to?
Yeah, so my study wasn't really on the mortality rates of neurodivergent individuals during the pandemic, but I did do literature review, and a lot of literature did include studies on the mortality rates on neurodivergent individuals. And I think one of the quotes that I included from my literature review said that people with intellectual disabilities are 2.7 times more likely to die during the pandemic. So that really struck me.
Yeah. But do you think it's an access to care issue? Because I was just thinking about telehealth as a way to.
Yeah, so some papers attributed that to not being able to adapt to the fast-paced changes of the pandemic. And I'm sure resource accessibility also played a role in it, because when there's short staffed and you're getting people coming through the doors. They don't, you know, kind of accommodations might go out the window because they don't have anyone to help with that. So I'm sure that did play a role, but I didn't find any literature specific to that.
Great, thank you. Any other last thoughts or questions? Great, well, thanks so much to all of the speakers. I am going to, let's see, turn it over, or actually, I think I have a few announcements to make, and then I will turn it over to Liz. But in the next time that we have, we will have a online poster session, and we would encourage you all to go. And Liz is going to tell you the names and titles of all of those. But before that happens, I want to just thank everyone who's been a part of this, all the attendees, all the speakers, and all the folks who put in many hours over the course of this year to get this conference going. And Liz, I have to just really acknowledge like all of the work that she has put into this. We really could not, I mean, it would be no conference without Liz. So thank you so much for everything you did. I wanted to remind everyone that we are going to send out evaluations by Monday of the conference, and that is what you need to do to be able to get your continuing education credits. And so please be on the lookout for those evaluations. We also want to encourage you to, if you aren't already a member of our maternal child health translational research team and you're interested in learning more, please, let's see, I think Liz is going to put the link in the chat for expressing your interest in that, but I think there's also space on the evaluation where you can note that you would like to be added to our distribution list. We meet monthly, and it's a great opportunity to share what the work that you're doing and kind of you know, set goals for how we can support you in your work. The recording of the conference will also be shared, and we will send out details related to that. Oh, look, there's the interest form right there in the chat. And we are looking forward to continuing this on next year. So on that note, there will be a link to click on to go into the poster sessions. And I'm going to let Liz explain that process. So thank you again so much.